Ativan is a medication that helps with anxiety, sleep, seizures, alcohol withdrawal, and nausea or vomiting in relation to chemotherapy use. Ativan activates the body's GABA receptor, which helps decrease the firing of the neurons and so therefore helps calm one's brain and body. It can be very effective, and dosing can range from as little as zero point 0.5 milligrams, taking up to a few times a day, to as much as 2 milligrams at a time, taken throughout the day. There's a pill form, an injectable form, and an intravenous form that can be administered through one's veins. So although this medication sounds great and it can help with all those conditions, it needs to be taken cautiously for several reasons. The body can get dependent on it, both physically and psychologically. So it typically should not be taken for longer than it typically should not be taken longer for 6 months. If someone has been on this medication for a good amount of time and taking it regularly and is planning to get off of it, it needs to be decreased gradually. Otherwise, there can be a risk of seizures. And unfortunately, seizures are one of those conditions which can cause someone to die suddenly. Other major concerns of Ativan is that it can slow down one's breathing. So the dose one should take cannot be too high, especially in people who are obese or have limited ability to expand their lungs. Opioid pain medications and alcohol can also restrict the breathing in a similar fashion, and so this medication should be used especially cautiously, if at all, in conjunction with these other medications or with alcohol use, as it can slow down the breathing even more and even cause one to stop breathing altogether, and unfortunately can be a cause of overdose. Moreover, if it's lost or stolen, the police should be notified and a police report should be filed. This medication can be abused, especially with those who have a history of addictions. Those are just some of the warnings and concerns. Some people are able to live a normal life with the assistance of this medication, and it can be useful. For example, in cases of anxiety, it can be helpful for people with anxiety that need something to work quickly or just for a short amount of time, like a few weeks or months. In cases of panic disorder, people can get such strong feelings of a panic attack that they're afraid to go out to the public, and this medication can help them so that they are able to go back out to public. In cases of sleep, it can be helpful as it can be sedating, but should not be used long term as it can alter the sleep architecture and hinder one's ability to get a normal sleep. In cases of seizures, it can help to stop a seizure suddenly, but seizures should be diagnosed and treated by a neurologist, which typically will need a referral from a primary care doctor. Alcohol withdrawal is also a life-threatening condition in which someone who's using a lot of alcohol goes a period of time without it. It can lead to anxiety, tremors, shaking, confusion, hallucinations, and even seizures. So alcohol withdrawal is important to treat, and Ativan is often the preferred treatment in these cases. One, because it can work in various ways, either by mouth, an injection, or through the vein. And also, people who abuse alcohol may have liver damage as a result, and Ativan can work even if the liver is damaged. So there are many other concerns with this medication. It's not recommended to be used in cases of which people are confused due to a medical condition. Not really good to use in people who are anxious or having trouble sleeping from dementia, as this can cause them to get agitated or have worse mood swings. Also, it should be used cautiously in people with poor coping skills, like those who suffer from intellectual limitations. One way to think about it is that Ativan works similarly to alcohol on the GABA receptor symptom. So when you get people who have liquid courage, for example, or do things they wouldn't normally do after having too many drinks of alcohol, this can also happen when someone has too much Ativan. So this medication can be very effective and have several benefits, as I described, but also there can be several risks, and I just highlighted some of the risks. So whenever taking a medication like this, be sure to weigh the benefits and risks and make sure you're doing the right decision for you and your loved ones.